Hello everyone, I'm your host Masilolo and welcome to PPEV. Our special guest today is Dr. Chamisa and he'll be giving us an insight on aesthetic veins. Ladies and gentlemen, please welcome Dr. Chamisa. Welcome back, Dr. Chamisa. You mentioned previously that you were also an expert in the treatment of varicose veins. What is varicose veins?
Thank you, Marcelo. So varicose veins, they are abnormal veins which are commonly found in the lower legs, and they are distended or veins which are dilated on the legs. And but you can find varicose veins even on the upper limbs or the forearms as well. And it's a very common problem in our population. But unfortunately, most patients, they do not know that there is treatment for varicose veins. So basically, these are veins which are either blue sometimes or in purple in color. And they are most commonly affect women compared to men, but anyone can get varicose veins.
Are there any known causes for varicose veins?
Well, the most common cause of varicose veins is a weakness in the wall of the veins. So we call this venous insufficiency. And sometimes patients are born with just a weakness of the veins, but sometimes it develops in life as we grow or as we age. And we also know that there are possible risk factors for developing varicose veins. This includes things like pregnancy, obesity, or any injuries or fractures on the lower legs. Those can cause varicose veins as time progresses.
Is there any way of preventing varicose veins?
Well, there is no 100% way of preventing varicose veins, but we know that there are ways of trying to minimize developing varicose veins. This includes maintaining an ideal weight, and secondly, also wearing compression stockings, and thirdly, just regular exercise also helps to prevent getting varicose veins.
What are the common symptoms of varicose veins?
The most common symptoms of varicose veins are most commonly cosmetic symptoms, which means patients don't like the way their legs look like. And it's commonly in women than men. And these veins can be quite unsightly due to their color or their size. And also we do have patients complaining of chronic aches and pains in the legs, swelling of the legs, and sometimes can develop complications in the veins, which include things like ulcers on the legs, which can be chronic. But lastly, there's a potential serious complication of veins called deep venous thrombosis, which can be potentially life-threatening. But most people do come in as a cosmetic issues.
Doctor, are varicose veins dangerous?
The majority of veins are not dangerous, Marcelo. They only complain of symptoms which I told you about already. But as I said, sometimes they develop blood clots in the veins, which can be potentially life-threatening. So we advise patients to come to be checked for the possible causes of these veins.
Dr. Chamisa, why should patients with varicose veins consult you?
Well, it's very important for patients with varicose veins to be examined and to be checked to see the underlying cause. It's because sometimes there are serious underlying causes for varicose veins. For example, any cause of increased pressure in the abdomen or the pelvis can cause varicose veins. There are patients who developed tumors in the abdomen which can present with the varicose veins. So it's important to know what causes the veins, and certainly it's good to prevent further complications once you diagnose it earlier. So it's important to know the cause for the varicose veins.
How are varicose veins treated?
We do have different ways of managing varicose veins. In the past, we used to do something called the stripping of varicose veins, but this way is now being almost obsolete, which means we no longer use it that commonly. We do have now new technology on varicose veins. There's things which we call radio frequency ablation or laser ablation, and something called a vena seal or vena wave. Now, the beauty of this technology is that it's an office-based procedures, which can be done the same day, you go home the same day, and there are minimal complications and side effects.
Doctor, it is always a pleasure having you. Thank you so much for that much insight. And there you have it. That's it from us here at PPEV. I'm your host, Masilolo. See you next.